Hello, I'm Dr. Jaspreet Batth from Dr. Batth's Dental Practice. We shall be talking about why is it important to replace a missing tooth. It is very important and mandatory that we replace the tooth as early as can be possible. Any delay in doing so leads to the movement of 5 teeth. Imagine, I'm repeating this for us, 5 teeth get to be at risk by not replacing one tooth which is missing. Now, for example, to highlight my point here is a tooth missing. These are the two neighbors. They will start to move towards each other over a period of time, given in years. The tooth above them exactly will begin to shift downwards, and the two adjoining the one which is right above this will also begin to have a space and a place available between them where food will find its way to get lodged and locked easily. And when that happens, that area begins to rot. And when that happens, imagine what a catastrophe it must be playing over those 5 teeth which are now losing their original place of anchorage and shifting to a new place. So like I said, it is mandatory for us to replace the missing tooth. Now we have choices how to be doing the replacement, either in the form of what is called a bridge, where we take the support of the two neighbors and the one that is missing is attached to the two neighbors and it comes in the form of a bridge like this. However, for no fault of these two, they get to be a part of the one which is missing in the replacement therapy. We have to biologically shorten them, sacrifice a little bit of this tooth structure here and here in order to be using these two as supports or as two pillars where the bridge becomes and gets seated over those two, and in the bargain the one that is missing gets to be replaced. If we had a choice of not taking these into the replacing of this, which is in the form of what is called an implant. This implant goes into the gum and from the gum into the bone. Finally, it gets housed and seated inside of the bone and remains there for the rest of the life as a part of the same system and part of the body there. After a few weeks, when the implant has become well anchored to the bone here, the dental surgeon puts what is called an abutment over this. Finally, a crown gets to come and seat itself over this. So it is the crown that comes to be seated over the underlying implant at a later date in a few weeks. The implant in place and the crown at that site. So eventually the tooth which is wanting replacement finds its replacement, but the neighboring 2 teeth have not been touched, biologically not been violated. Whereas similar is not the true situation when a bridge is to be made. Like I said, these two, for no fault of theirs, will get to be a part of the making of the bridge. Between getting a replacement vis-a-vis an implant, vis-a-vis a bridge, if the choice is amply clear, the decision is for us to make. It is for you to make. Make the wiser decision. Thank you.